Okay, so what we're going to talk about is Reconstitution of Botox. All right, and I'm going to pass around this syringe. I know you probably remember this, or you know this in your office, but I would like to just kind of remind you a little bit, you know, what 4 units is, in case you haven't used a tuberculin syringe in a while. All right, so I'm just going to kind of pass that around, because the objective here is, you can see from the slide, when you mix this properly, this is Allergan's recommendation. This is the how the FDA wants you to do it, and this is Allergan's recommendation. Is when you prepare your Botox in this manner, okay, the resulting dose is going to be 4 units for every 0.1. All right, so when you inject somebody's forehead, usually what I do is I'm either injecting 2 units or 4 units, okay, per area, per dot. Okay, so either 2 units or 4 units. There's some cases where you're going to inject 1 unit, all right, sometimes around the nose and some of the small areas you'll inject 1 unit, but generally speaking it's usually either 2 units or 4 units. All right, so let's take a look at this, okay, and what this is showing you is that with your bottle of Botox, when you get your bottle of Botox from Allergan, and that's where you want to buy your product, there's a lot of stores, there's a lot of places, you could import it from out of the country and all these things and save a couple dollars, but you know, legally and the correct manner is to buy it from Allergan, okay? Your Botox comes the next day, it comes in a box packed in dry ice. You want to have it refrigerated, of course, and we'll talk a little bit about that, but as far as how to prepare it, what you're doing is you're taking 2.5 cc's or 2.5 mLs of saline, and you're putting it into your bottle of Botox, all right, very gently, and we'll show you the mechanism on how to do that. And when you do that, the resulting dosage is going to be 4 units for every 0.1. All right, these are other ways that you could prepare it as well, okay? And then you can see that, you know, you'll have different dosages. They'll be either stronger and weaker for every 0.1. But this, I find, this really is the best way, and it's the way that they recommend it, so I would definitely suggest that you do it that way. Okay, a couple quick things about how long the Botox lasts and things like that. So let me kind of skip over to that. All right, first of all, again, you're buying your Botox from Allergan. It arrives the next day, packed in dry ice. You put it in your refrigerator. How long can you keep it refrigerated once you're reconstituted? How long can you keep it refrigerated? It's a trick question, so don't read ahead. Does anybody know how long? So once you've reconstituted it, now you put it in your refrigerator. All right, how long can you keep it? How long does it last? A month, 2 months? Anybody have any idea? The answer is it depends on how you mix it. Okay, it depends on what product that you use, what type of saline. If you use a preservative, okay, versus a non-preservative, okay, and the FDA and Allergan has its FDA approval using a non-preservative, okay, a non-preservative. When you use a non-preservative, it only lasts 4 to 6 hours. All right, so that means typically you have to line up your patients. A bottle of Botox can take care of maybe 2 patients, 3 patients, depending upon how much they need. All right, so it can only last hours. If you use a preservative, on the other hand, which is becoming pretty standard, again, there's that consensus I told you about and so forth, it's pretty standard. Now it can last weeks, okay? Now it can last 6 weeks. Some people say up to 8 weeks, but 6 weeks in the refrigerator. Remember, this product needs to be refrigerated. All right, so it's pretty common that people use a preservative, they mix their Botox in this fashion, and they keep it in a refrigerator for up to 6 weeks. Now, next question I want to ask you is what do we pay per unit of Botox, okay? Typically, Botox right now is $525 for a bottle, and it's 100 units. So who's really quick at math? What do we pay per unit? If it's 100 units for $525. So, okay, close, one more decimal point over. So it's $5.25. So if you think about it, we're paying $5.25 per unit. And the reason why that's important to know is think about it. When you're injecting somebody and you have a patient, you know, it's important to remember that when you're charging, you know, how much you're going to charge. You know, be careful. Don't charge, you know, $7, $8. You know, it's your time. What is your time worth? You know, and that's how this procedure is not profitable when you start charging very, very low rates. You know, this is a skill. You know, think about your investment to get here, your investment to take this, your degree and everything. So really the going rate is between $10 and $15, actually up to $18 per unit. All right, so a minimum of $10 per unit and up to $18 per unit. Some people unethically, and be careful about this, they don't mix the Botox correctly. All right, if you start putting more saline in there, 3 cc's, 3.5, 4, what's going to happen is you'll add a little bit more profit, but that patient is not going to come back consecutively because the Botox is only going to last, you know, a month, 2 months, or whatever. You're not doing the right service for them. So make sure, you know, it's 2.5 and you give them the full strength. It'll last 3 months. They'll come back every 3 months and they'll be very happy. Okay, so any questions on that? All right, good. That's all I have for the reconstitution of Botox.